Salmonella infections. Introduction. Which group has a high risk for salmonella infections? Choose one of the following options. 1. Elderly people. 2. Infants. 3. People with weakened immune systems. 4. All of the above. Correct. All of these people have a high risk for salmonella infections. Special care should be taken when caring for these people. Symptoms may begin as late as 3 days after being infected with salmonella bacteria. Select true or false. Correct. Symptoms usually begin from 12 hours to 3 days after you are infected. They may last for 5 to 7 days. You can become infected with salmonella from eating unwashed fruits and vegetables. Select true or false. Correct. Fresh produce may be washed with contaminated water. It is also possible for juices from raw meat and poultry to come into contact with uncooked foods like salads. Most people with salmonella infection require treatment in a hospital. Select true or false. Correct. Salmonella infections often go away in 5 to 7 days without treatment other than oral fluids. Infection with salmonella can be life-threatening. Select true or false. Correct. Salmonella infection may cause typhoid fever. People with immune system disorders should avoid touching reptiles. Select true or false. Correct. People with immune system disorders have a higher risk for salmonella infections. They should not handle reptiles. These animals are known to carry the bacterium that causes the infection. Thank you for using Explain.